you cannot live in Paris when you have a child and no husband sometimes with 1,480 euro when you start to be a nurse. So there is a real issue here that has to be fixed, and you cannot pay your apartment or your food or your babysitting with applause. So now the government has to pay very quickly the additional hours performed by the nurses and the others, and has also to announce very quickly in the forthcoming weeks, not in 6 months, that there will be a substantial increase to just try to reset the salary of the lowest salary employees of the public hospital at the mean level at least of OECD, as you mentioned before. And I think this is really the emergency, because even if you can build a team that is really working well, even if you take care of your team and you see your nurses regularly and you try to make the job more easy every day, it will not be sufficient. There are really pragmatical things for daily life that they have to face that are too difficult. You cannot have a 2-hour transportation to come to your work on the morning time and 2 hours more in the evening time. It's too long, and there are many issues that have to be fixed. So we are trying in my institution also to motivate the governing boards of the institution to find also apartments and a lot of facilities for the nurses. And I hope this will come soon, but at the national level, the salaries remain a major issue, I would say.
Do you feel optimistic? Do you trust what the government's saying? Do you have any faith in the politicians? Julien.
What is interesting is that you mentioned at the beginning the OECD level of France, which is 29 or 28, depending on the calculation, out of 32, which is not normal because France is probably the 6th of the 7 power in the OECD. So these numbers were claimed by us initially 6 months ago, and now everybody is using them. So I think that little by little the government understands that we cannot manage the public hospital like we are managing an industry or whatever, a company. It is something special, dedicated to health and patients, and it has to be like that. Sometimes it costs money, but when you invest money in that system, generally you save a lot of money. Imagine that during the and then we would have been able to take care of all the patients and not to have all this stress. The confinement should have been more selective, and probably that the economical consequence for the country should have been really less impressive than what we are going to see now. So I think this is the problem is that everybody is thinking short term today, and nobody sees, as said Jean-Jacques, until you don't have someone in your family that is sick, you don't see really the utility of spending so much money for the